Welcome back to our BCBA Exam Prep Series, where we go over the TCO 6th edition for the exam. We will be going over part 2 of the 6 attitudes of science in this video. For a full explanation and breakdown, check out the other video that was posted on the philosophical assumptions going over the 6 attitudes of science. We're going to go through some examples and see how you do. A behavior analyst is working with a teenager who engages in self-interest behavior. Rather than accepting the school counselor's explanation that the student just has anger issues, the behavior analyst conducts an FBA to identify variables maintaining the behavior. So then it's discovered that during difficult tasks, the analyst implements an intervention that includes task modification and breaks. Which attitude of science is best demonstrated in this scenario? So pause if you want to think about it. The answer is B, determinism. The behavior analyst assumes behavior is determined by environmental variables that can be identified rather than attributing it to internal anger issues. Next question. After hearing from colleagues that a new token economy system is amazing, a behavior analyst decides to implement it with the client. However, before full implementation, she collects baseline data, then implements the token system while continuing to collect data on the target behavior. She compares pre- and post-test interventions to evaluate the effectiveness. Which attitude of science is best demonstrated in this scenario? Empiricism is shown here. The behavior analyst does rely on direct observation and measurement rather than accepting the intervention based on clients' or colleagues' testimonials. A supervisor tells a new RBT, trust me, this intervention always works with the kids like this. We don't need to take data on this client because I've seen it work a dozen times. Which attitudes of science is being violated in this scenario? Empiricism. The supervisor should be using data and direct observation on the current client. Next up, a behavior analyst wants to determine if a visual schedule is effective for decreasing transition problems. She implements an ABAB design where she collects baseline data and implements the visual schedule, withdraws the schedule, and returns to baseline. The data show that problem behavior decreased only during the B phase. Which attitude of science is best demonstrated in this scenario? The answer is C, experimentation. The behavior analyst systematically manipulated the independent variable, visual schedule, and demonstrated its effectiveness on the dependent variable. Next up, a researcher develops a new protocol for teaching joint attention skills. She writes a detailed manual specifying the exact prompting procedures, reinforcement schedule, materials, setting requirements, and measurement system. The protocol is then implemented by different therapists with different children across multiple clinical settings. So which attitude of science here is best demonstrated? Replication. So those of you thinking technological, although that is discussed as far as the writing and the specific prompting procedures, the key here is the replication mention. It talks about how it is implemented by different therapists with different children across multiple clinical settings. Next up, a child frequently leaves his seat during circle time. After a functional assessment, the behavior analyst determines that the behavior is maintained by escape from demand. Rather than developing complex hypotheses about potential sensory issues, attachment problems, or developmental readiness, she implements an intervention based simply on providing more frequent breaks and reinforcing sitting behavior. Which attitude of science is best demonstrated in this scenario? You got it. Parsimony, the behavior analyst chose the simplest explanation, an intervention that explained the most reasonable issue here, which is just needing more frequent breaks. A therapist observes a child engaging in hand flapping. She develops an elaborate theory involving sensory processing, neurological development, emotional regulation, etc., to explain the single behavior, when direct observation shows it occurs primarily when the child is left alone without activities. So what is not being considered here or demonstrated in this scenario? You got it. Parsimony. This is an example of an unnecessary complex explanation when a simpler one could be used. We really should just leave it alone. A behavior analyst has successfully used differential reinforcement of alternative behavior with many clients. When implementing it with a new client, she continues to collect data and notice that progress is limited. Despite her previous success with the intervention, she reviews the data, questions her approach, and modifies the intervention based on current client-specific pattern of responding. So which attitude of science is best demonstrated here? You got it, philosophical doubt. The behavior analyst does remain open to revising her approach based on new evidence rather than assuming her previous success and intervention for everyone else. So I hope that review helped. Comment below if you want any more examples of any of the 6 attitudes of science and maybe which one you find most difficult. I'm sure others can relate. Make sure to subscribe to get the most up-to-date notifications on the weekly videos that are being posted. Thanks for watching.